Welcome, everyone. I'm Tom Farmer, and you're listening to Health Talks. We want to share information between patients, employers, and doctors. Together, we can all make healthcare more accessible for everyone. So every Wednesday morning at 8 a.m., let's spend 6 to 8 minutes on the most talked about issue of the week. Today's question really focuses on the quality of healthcare. So I've had a lot of questions around how can we measure the quality of healthcare? How do we know what to review? This is a little bit tricky right now. I want to give you a couple items to look at, something that you guys can go out there and find fairly easily or ask when you're facing a surgical procedure and try to figure out what you can do. I mean, certainly you want to do the regular things. You want to ask your friends, your family, your peers, coworkers, and find out who has been to a physician or that particular physician and what kind of outcomes and results they got. And I would ask sort of a little more deeply. And most physicians want you to do this. They want you to ask their patients, how things went, what was going on. I mean, they're looking for ways that they can improve, and they're very cognizant of what they want to do to make sure that the patient has a good experience, not just physically, but also in other aspects as well. So let me give you one of the main things you can look at, and your first question, and that is, in general, you can start with the facilities. In other words, is your procedure being done in a hospital or a surgery center? That's kind of the first question I might want to ask. And the reason is because hospitals have infection rates that are 10 times that of surgery centers. So before everybody gets scared and excited, just keep in mind that infection rates are well below 1%. So most hospitals, they don't even approach 1%. They're, maybe at 0.75%. So the difference is, though, the surgery centers are 1/10 that. Many surgery centers that are singular focus, and in fact, a lot of the surgery centers, they might have 2, 3, 4 operating rooms. Each of those rooms is designated within a certain range of specialty. Like if you're getting a colonoscopy, that room is only going to be for colonoscopies and endoscopic procedures because they focus on certain tools, certain cleanup practices, certain sterilizations. So they really, really try to focus to pin down and tamp down any potential problem with infection. Even within a hospital, they still try to do that same thing. It's just that hospitals are much bigger. There's more chance and movement. There's more variety in staff, and for whatever reason, and I'm not a hospital or surgery center expert, but I know you just look at the numbers, and the fact is, surgery centers are about 1/10 of the infection rates of hospitals. So I would just say, if you can and you do have the choice, I would choose the surgery center. Also, let's see, what else can you look at? You can also try to look at some things that are out there. It's harder to find, things like recidivism rates. I mean, you almost want to ask the doctors, or there's a if you really got technical on this, you could go to the CMS, the Center for Medicare and Medicaid Services, and they keep data on some doctors, some hospitals that relate to all kinds of things. There are about 12 measurements that relate to quality. It's a little hard to get. It's hard to find and track, but if you really want to look at it, you can try to dig that up. And they're going to look at things like the recidivism, so that if your doctor's doing a knee arthroscopy, what's the percentage of redos that the doctor has to do? So that's something to keep in mind and look at. I would try to find out, number one, the infection rate, and then number two, I might see if I could look for the recidivism rate. I might ask the doctor about that, And keep in mind, depending on your surgery, like let's say let's say you have a very, very complex knee surgery. So, and that's the doctor's specialty. So the doctor does knees of someone who just really got ripped apart. Well, those are hard and they're complex. So somehow that has to be kept in mind of what that quote redo is. And doctors will mostly be very, very straightforward about this. You just need to ask. You just need to ask and say, hey, doc, I know my knee is really ripped to shreds. I mean, maybe you're a major skateboarder and you just ripped it apart on a double flip loop, whatever it is you do. The point is, it's going to be tough, and that doctor will be straightforward with you. He'll look at your knee, he'll look at your injury, and he'll tell you what the odds are. So ask and get a feel from those doctors who you feel like is directing you in the way that you want to be directed and has your interest in mind, and you feel like they're taking you down the path you want to go. So anyway, those are just a couple items. It's hard to do. You could also look at things that, are in terms of their credentialing. I mean, every doctor has to go through the internship, the residency. There are some doctors that go further and they do fellowships. So depending on the specialty, depending on what you're doing, you might want to look and see. Different universities and hospitals have different, branding and different, levels of what you believe is a better school. So you might look at all that, although, that's quite a bit usually away from where you're looking. But, look at all of these things, take them all into account, and just, quick summary again. Number one, hospitals versus surgery center, which is really about infection rates. If the physician is saying, no, we really need to do this in a hospital because it has this equipment, this staff, this particular specialty, et cetera, et cetera, et cetera, you might ask him, well, what's the infection rate? I mean, just, check it. And then you can also look at the credentials, ask about a fellowship, et cetera. I hope that's given you some stuff that's going to be helpful when you're taking a look. Again, I would just say, really get comfortable, ask your doctor. They love to answer questions, and, good luck out there. Let us know anything that we can do to help, and I hope this helped in terms of this question. Thanks a lot, and thanks for listening to Health Talks. If you liked our podcast, please share it. We're all going to be customers in the healthcare business at some point. So join our mission, our partnership of physicians and patients, and let's make healthcare more accessible for everyone. Please review, rate, and subscribe. Submit your questions. You can go to our blog at Healora, HEALORA.com/health talks. We'd love to hear from you. Thanks for listening.